celebrity plastic surgery thoughts from an oculoplastic surgeon, Dr. Paul here. And the next celebrity we're going to look at is Anya Taylor-Joy, and she is well known to the screen, and she's most recently been in Dune 2. And we're going to look a little bit at her eyelids. And again, this is someone in her mid to late 20s. And did she have something done? Did she not? And it's really interesting to see this trend, because we used to see with models like Kendall Jenner that had lower set brows, that was a very, very popular appearance not even 5 years ago. What we've seen over the last few years is a trend back toward a more open eye appearance. Even my patients are asking me for a more open brow appearance. Now, this is different than the cat eye, but in her case, certainly you can see that either, number one, in the photo, she's simply just overexpressing. So maybe this is smoke and mirrors. Maybe she had nothing done at all, and she's just kind of posing for the camera and her brows are higher. Now, if at rest, you can see that her brow is still lifted and there's still space between her eyelashes and her brows, then more than likely there's been some intervention done. And the two most common things we see are injectable toxins like Botox and Xeomin, and those can work really nicely to relax some muscles here and here and allow the brow to be lifted naturally without any cutting whatsoever. And the second more permanent option, again, is an upper eyelid surgery. Now, we vary the amount of fat we remove around the upper eyelids. Some surgeons don't take any fat at all, and that leads to a nice youthful look. Other surgeons take out too much fat, and that leads to a more hollow appearance. So you want to be really conservative with that, because you don't want to over-age the patient's eyes. The second thing is the brow, and like I mentioned, the flatter brow appearance had been really trending, and now we're seeing more of an open appearance. And there's a few techniques. You can either approach from the temple, you can go through the eyelid skin, or you can go from the top of the forehead, and you can kind of contour the perfect brow position for the patients. Now, one important thing to think about here is the brow and the eyelid are essentially one unit. So you want to think of them both together, because you don't want to remove too much skin around the upper lid or lift the brow and not do anything for the upper lid at all. So you want to think of them together as sort of one unit, and they're an expressive unit. So photos are simply a one quick 2D shot. You want to see how a patient smiles and how the expression happens, as well as when they're making a surprise look, you can really tell if they've had something more permanent done. So again, this is Dr. Sean Paul reviewing photos of celebrities and what they may have had done.